Welcome to Black Women's Health. I'm Dr. Rahman. Fridays are usually reserved for when I give answers to common female concerns, and I welcome the questions. Over the past few weeks, I've been discussing abnormal uterine bleeding, a big topic with multiple possibilities as the cause. To date, we've talked about polyps and adenomyosis as being a possible cause for abnormal uterine bleeding. And this past Friday, I was to talk about leiomyomas, otherwise known as fibroids, which are often the reason for abnormal uterine bleeding. But something happened along the way. I received a message from a former patient, and she said basically that she was menopausal, had had a hysterectomy, removal of the uterus, an oophorectomy, removal of her ovaries, and was now struggling with low libido and vaginal dryness. And she was reaching out. She wanted to schedule an appointment. She wanted to be seen as a patient for suggestions as to what she could do to make her situation better. While I welcome the contact and I welcome the question, because I am no longer involved in direct patient care, I couldn't give her an appointment. I couldn't respond to her specifically, but I decided to take this platform and use it as a way to respond to several of her concerns, because the first thing she needs to understand is that she's not alone. The symptoms that she described are actually very common. And while I would like to compliment myself and say that she reached out to me because I was such a wonderful doctor, truth be told, I am a wonderful doctor. What I really think the situation was is that she felt comfortable talking about intimate concerns. And that's not always the case in the GYN office. So I'd like to take just a few moments to digress. This week will not be about abnormal uterine bleeding. I will continue that next week. This week, I'd like to speak briefly about menopausal symptoms. And I want to start by reiterating the fact that you're not alone. Now, every woman will experience menopause differently. Some women will breeze through and not have problems. Other women will have hot flashes, other vaginal dryness, mood swings. It's variable. It's variable, which means that you have to be specific when you're seeing your gynecologist. I advise that you write it down so that you don't forget. And you need to be comfortable saying what it is that really concerns you. Meaning, if the problem is low libido, don't say it's hot flashes. If the problem is urinary incontinence, don't say it's mood swings. You need to be honest about your symptoms. And that implies that you need to be comfortable with your physician. And if you're not, that's an indication that you need to look elsewhere. So, my first is to be honest about your symptoms. The second is to be comfortable sharing with your physician. And if need be, write it down. If you have a list of concerns, make sure you list all of them. And know that there are many options in terms of treatment. One size does not fit all. You could go the holistic route, and that includes decreasing the stress in your life, decreasing alcohol intake, decreasing the amount of processed foods, increasing your exercise, increasing whole foods, plant-based fruits, vegetables, legumes, breath work, a yoni egg, and then there's medications. There's hormonal replacement therapy because we know that the reason you're symptomatic is because of low estrogen. And sometimes the answer is to give you hormonal replacement. There are other medications available to you. Be specific concerning your concerns. And thirdly, you should know that because menopausal symptoms are quite variable, there are now AI generated programs that will take your medical history, your symptoms into consideration in an attempt to generate a personalized solution. Right now is a great time to consider where you are, what are you looking for, what type of options are you most interested in, knowing that there are many options available to you. So, this is Dr. Rahman. I welcome your questions. I hope that this is helpful. If I can answer questions for you, I will use this platform to do so. And again, next week, remember, we continue our discussion about abnormal bleeding, the topic being fibroids. Until the next time, take care.